Hello and welcome to It's a Code You, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. Welcome to It's a Code You. This week, we are going to be talking about seasonal affective disorder, or SAD as it's sometimes referred to. Just a few facts about seasonal affective disorder. It's very common, and there are more than 3 million cases each year in the United States. This is the type of depression that's related by the changes in seasons, most often affecting people in the fall through the winter months. However, there are cases that don't follow that pattern. Here with us today to answer our questions about SAD is Dr. Sarah Roane. Sarah Roane is a psychologist and the clinical lead for Dartmouth Health Behavioral Health Solution. She has been a mental health professional for over 20 years, and before coming to dhbhs, Sarah was the director of mood disorders psychological services for outpatient psychiatry at Dartmouth Hitchcock. Sarah, we appreciate you being here today.
Thanks for having me.
Well, we're super excited. And Jennifer, I'll let you get started and then I'll go after you.
Well, welcome, Sarah. It's great to have you here. And we'll start off first with kind of the foundational question. What is seasonal affective disorder? And is it different from major depressive disorder?
Yeah, that's a great question. So, seasonal affective disorder is a type of mood disorder. And mood disorder is just terminology for depression and bipolar disorder. The seasonal affective disorder is a description for a type of usually depression, but any type of mood disorder where the symptoms get worse in a seasonal pattern. Typically, what we see most often is symptoms getting worse during the autumn and winter, and then some improvement in the spring and summer. Although, as Adina mentioned, there is also a different pattern that I'm happy to talk a little bit more about. So, seasonal affective disorder, which I think probably we'll call SAD quite a bit in this episode, it's much easier to say the acronym. It was first described in about mid-1980s by a psychiatrist named Norman Rosenthal. And then it was added to the Diagnostic and Statistical Manual, which is just the book that doctors use when they want to diagnose when people are having some problems with their mental health. So it was added to that book in 1987. And you'll see that even currently, it is in the current version of the DSM. It's what's called a specifier. And a specifier is just a way of adding information to a diagnosis. So technically, a seasonal pattern, seasonal affective disorder, it's just a specifier for major depressive disorder. And what you're saying is that these is similar symptoms. We can talk a little bit more about some of the ones that are most common with seasonal affective disorder, but similar symptoms to any other sort of major depression or mood disorder. But again, the real differentiator is that the onset happens during one season and then it tends to improve over time as the other seasons come in.
So, what are some of the symptoms of SAD that somebody should be on the lookout for?
So some of the most common symptoms of SAD are increased sleep, daytime drowsiness, loss of interest and pleasure in activities that are activities that previously were enjoyed. People tend to withdraw socially. They might be more sensitive to rejection. Sometimes people describe feeling really grouchy or anxious, a lot of feelings of guilt, sometimes hopelessness, sort of excessive. I mentioned daytime drowsiness, but people will also feel fatigued, even if they're not necessarily drowsy. They can find a decrease in their sex drive, decreased ability to focus, some difficulty thinking clearly. A lot of people experience an increase in appetite and for sweets and carbohydrates in particular, which can also lead to weight gain. And some folks experience physical problems such as headaches. And something of note is that these symptoms, the particulars of these symptoms, one, that these are symptoms that are most likely occurring with the winter pattern seasonal affective disorder. And that it's probable that the specifics of these symptoms are related to what we think are the causes of seasonal affective disorder. We don't know for sure what causes seasonal affective disorder, but there's some indication that less sunlight and shorter days are part of the problem, and melatonin, which is a sleep-related hormone, and serotonin may both be linked to seasonal affective disorder. As the seasons change, people experience a shift in their internal biological clock and their circadian rhythm, which is part of what helps us regulate our days, our sleep, our awake times. And so those shifts in those internal rhythms can cause problems in our daily schedules, but seem to be a big part of what is causing seasonal affective patterns of depression.
Very interesting. That is excellent information, Sarah. Thank you. So, Sarah, I was wondering, is it possible for someone who has traditionally experienced SAD during the winter months, can they also experience it in the summertime?
Yes. So it's really interesting. The summer pattern seasonal affective disorder is sometimes called summertime sadness, which makes us all think of Lana Del Rey, I'm sure. There's less research that's been done on summertime seasonal affective disorder, but they do think again that changes in daylight duration, exposure to natural light have that impact on mood. So in the winter, we have reduced exposure to natural light and shorter days. And then in the summer, sometimes we have excessive exposure to bright light, and that can disrupt our circadian rhythm and contribute to mood changes as well. So weather and light are involved in the regulation of serotonin, melatonin, but something that's really important to know is that one of the risk factors for seasonal affective disorder is where you live. People who are at higher latitudes are more likely to develop seasonal affective disorders, but the winter pattern in particular. So in New Hampshire, the rate is about 9.7% of folks, close to 10% of folks experience seasonal affective disorder, which is pretty high. But down in Florida, it's closer to 1.4%. So you can see how where you're living and how long the sun is available to you during the days makes a difference. So when you think about summertime pattern, it was more obviously a bit of a reverse. So if you are living in Florida, the heat, the long days might have more of an impact. And another factor that they are considering or think about is that heat, humidity, body temperature have all been connected to depression. So, in addition to the exposure to sunlight, one of the concerns that they have for summertime seasonal affective disorder is people who have a lot of exposure to being in really hot, humid locations. So they think that it's more common in warmer, more humid locations and places that have limited access to air conditioning.
That is really fascinating, and it's a twist on what I thought maybe the research would indicate. Because I would think if you're living in a more humid climate, that would actually have the opposite effect. You'd maybe be less prone to it, the sauna effect. So it's really interesting. Thank you.
What I will say is that, again, from what I've seen and heard, uh, there has been less research done on the summertime pattern, but I do think it's important for people if they're considering, it feels more unusual. And if you're considering, if you notice that you have experienced more depression in the summer, you might want to think about where you are. Are you finding that you're hot a lot of the time? The other thing that's really interesting is that when they look at the different patterns in winter seasonal affective disorder versus summer, in winter, people tend to be lethargic. And for people who experience an increase in depression in the summer, they tend to be irritable and more restless. And so those are, again, still can be symptoms of depression, but it's sort of a different expression. And so if again there's sounds like different mechanisms likely happening in the body, potentially impacting similar systems, the circadian rhythm, but still having different effects. So you might find that if you feel more down or have more difficulty in the summer, you might find that you're more irritable and agitated and restless as opposed to people who experience more depression in the winter who might feel more lethargic.
I was thinking about when you were talking about the areas that are very hot and maybe they don't have air conditioning, like some of the more southern areas and the humid. And I feel like I'm gonna disagree with you, Jennifer. It is very humid here. I can understand why people would have more instances of it because the humidity is so draining. It's so hot. If I didn't have air conditioning, I don't know. That would be very hard for me.
Well, it's interesting, right? So to both of your points, when they have looked at how do we treat depression that seems to be related to heat, and this is related to heat, actually not specific summer seasonal depression, but they do think there might be a correlation. So it's an interesting thing to think about. When they look at it, they've looked at treatment being going for a cold swim, taking a cold shower, going in someplace with air conditioning, and people do get short-term relief from that. But in this unexpected, or maybe not unexpected, but this counterintuitive experience, exposure to high heat via saunas and hot tubs can offer longer term relief. They've done some clinical trials and they found that people's depression improved when they were treated with hot baths. So they think this short duration, high intensity heat can reset these like either dormant or dysfunctional thermal regulatory systems. But I have to say, I don't, it certainly is not something that most people think of necessarily. And certainly, I think if you are someone who's experiencing heat-related irritability, or you think this might be a concern for you, you want to talk to your doctor and think about what's the appropriate treatment for you. But it is really interesting that they have these two sort of counterintuitive ways that people find relief.
That makes sense to me though, because I think about things that like in short duration are really invigorating and wonderful, but if you had to endure them for a long time, it's like, no, thank you. So, and endless days of just very hot, humid heat, it makes me tired. Maybe I have it. Maybe I have sad during the summer. But to your point, when you're talking about talking to your doctor, what kind of treatment does work best for those dealing with sad?
Yeah, so focusing on thinking a little bit about the more common pattern, which is the winter pattern seasonal affective disorder, one of the really effective treatments is called light therapy. And what we're talking about when we say light therapy is you can purchase light therapy boxes. You can sit in front of a light therapy box and it emits a very bright light, but those boxes actually filter out the harmful UV rays. So that's a really important consideration. And typically you would sit in front of that light box for about 20 minutes a day, first thing in the morning during the winter months. So that first thing in the morning part is relevant because again, we're talking about circadian rhythms and these biorhythms. And so it may be kickstarting something in your system. So you do want to do that in the morning if you can. And so most people see some benefit after 1 to 2 weeks. And then you want to continue doing that throughout the winter to maintain the benefits and to prevent relapse. Something that, again, speaking to your doctor, sometimes they can write a prescription. Some plans will cover part of the cost of a light box. So it is worth checking with your insurance plan, checking with your physician or your provider. But other treatments that you may be more familiar with are also effective. So cognitive behavioral therapy, talk therapy is effective. One of the things that they've looked at in terms of is talk therapy treatment effective and what makes it effective, a lot of times when people experience seasonal affective disorder, they start to develop some beliefs about winter based on their experience. They think, oh, it's going to be dark all the time. Oh, I'm going to feel sad the whole winter. I can't do anything, and they may become inactive. And so CBT can help try to address some of those unhelpful thoughts, and help people to find ways to engage in pleasurable activities and give them more of a sense of empowerment over their own experience. So CBT is effective, and prescription antidepressants are another form of treatment. And again, if you have questions about medications as treatment, we really encourage you to talk to your psychiatrist or your primary care physician or primary care provider.
Well, that's great information and really wonderful to hear that insurance might even cover a light box. That's awesome. I had no idea. Now, speaking of treatment options, how might the treatment options differ for folks who experience SAD in the spring and summer months?
Yeah, if I think the light box therapy wouldn't be so necessary in the spring and summer. CBT and antidepressants would still be a good treatment option. Um, and I think, unfortunately, there isn't as much of a wealth of research around summer depression. But I do think that, again, thinking about biorhythms, looking at sleep, if you're finding that your routine is different. If you're having difficulty sleeping, I don't know if either of you have ever traveled to latitudes where there is sun for 18, 20 hours a day, but it's a big change and shift. So depending on your situation, is it relentless heat? Are you having long days and you're having more trouble winding down at night? Noticing what's changing in your biorhythms, finding ways to address that. And I do think that, again, if you're noticing that you're oppressively hot all day, if there are opportunities to cool yourself down or reset your system, those are good opportunities to take as well.
I'm also wondering, because I've heard some of my own clients talk about they experience SAD in winter, so they pre-plan. Do you think that pre-planning for SAD once you've experienced this is helpful? And if so, are there certain things that you think should be included in a pre-planning plan?
I do think it's helpful. I think that many people do experience, if this is a pattern you experience, the pattern means that it does reoccur. You certainly know you're vulnerable to it. So, one of the things that people often do is, in anticipation of the symptoms returning, people begin doing light therapy early in the fall in order to prevent symptoms or reduce the impact that they have. Other folks, if they are take medications, they might work with their prescriber to either resume medications again in early fall or to increase the dose of medication in anticipation of this pattern that they've experienced in the past. So that's definitely something you can work with your provider on. And if you have done cognitive behavioral therapy in the past, or even if you're just aware maybe that you have some unhelpful thoughts around winter time, you can go back to some skills that you've learned or reconnect with your therapist. A lot of therapists know, hey, people might come back to see me at a time where they're vulnerable. Some other things that people can do in general is try to plan to ensure that you can maximize your exposure to getting daylight sunlight. So if it's dark for when you leave for work in the morning and dark when you come home, you want to try to go for a walk at lunchtime if you can, or if you can arrange your home or your office so you can be near a window during the day, that can be beneficial. But the reality for a lot of people in healthcare is they can't do that. They may not be able to be near a window during the day. They may not have an option to go for a walk at lunch if they have lunch at all. There is a sense of what is possible in your life. Are there opportunities to get natural light? And if there truly are not, and you can't problem solve that, that again the light box can be really beneficial. Um, and then taking opportunities on days where you do have more flexibility to be in the light if you can. And then something else is as this time is coming up, really being attentive to your general wellness, right? Trying to move your body in ways that feel good to you. Eat nourishing foods, try to get sleep the best ways that you can, staying active and connected with the people in your life. And those are all ways to really get yourself set to be in the best place that you can, anticipating a season where things might be a little more difficult.
These are excellent tips. And it actually makes me think about a lot of what I've been seeing on social media and the TikToks about supplementing vitamin D, especially as we're coming into fall and winter. What are your thoughts on that? I know you mentioned eating good, nutritious foods, things like that. But what about the vitamin D, Sarah?
What I'll say is that I would recommend people see their doctor because your doctor can check your vitamin D levels. And there is a mixed bag out there about vitamin D. And I'm not an MD, so I've looked at some of it. I am someone who was a doctor checked my levels actually when I lived in Georgia. And you would have thought I had the most vitamin D, but I had low vitamin D. So I've been taking it, but I have noticed in the past few years, that there's been some debate about it. I think that in general, it's something that's worth checking. But again, because there's some different messages out there, I think that's something that's really worth having a conversation with a provider about. Again, historically, it's been thought to be very important, something that's worth supplementing. It's just there's some new data out there that says maybe it's not, but maybe it is. And doesn't that feel like all research, everything that we read, maybe drink wine, maybe don't drink wine. But with vitamin D, that is something that they can check, your provider can check your levels. And so I think that's absolutely worth, if you're noticing or you're concerned, or even if you're just curious, you can go in and talk to them about getting that tested.
Well, I appreciate that's great sage advice to all. And oh boy, wouldn't it be wonderful if vitamin D was in wine? But that's another topic for another show. But thank you. That's great advice. Folks, check your vitamin D.
I know we talked about different areas of the country and the world and that, but who is most at risk to develop SAD? Are there certain predispositions, or is it mostly just about where you live?
Well, where you live is a big factor, but there are some other factors. So, people who already experience depression and depressive disorders, people with bipolar disorder are at increased risk of seasonal affective disorder. And so, for folks with bipolar disorder, one of the patterns that they might see is that they have more bipolar depression in the winter months, and that spring and summer can bring on symptoms of mania or hypomania. So, that again fits with what we've heard in general, right? That increased irritability and agitation sometimes in the summer and more lethargy in the winter. So depressive disorders, bipolar disorders, interestingly, people with ADHD and related disorders are more likely to have seasonal affective disorder. They think this may be due to the fact that both ADHD and seasonal affective disorder seem to involve disruption to circadian rhythm. Women are more likely to have seasonal affective disorder than men. We're not quite sure why, but some research suggests that sunlight can affect serotonin levels, and serotonin levels are also affected by estrogen, and women have higher levels of estrogen generally. So whatever the underlying mechanism is, women are more likely to have seasonal affective disorder. It can start at any age, but typically starts when a person is between the ages of 18 and 30. There's thinking about, so it is a type of depression, right? It's a specifier for major depressive disorder. So it's not really considered a separate entity, really. It's a particular pattern of a depressive disorder. And we know that major depressive disorder has a big genetic factor. They're not, it seems a little unclear in terms of the patterns of genetics. If you have a higher risk of this, because you have a pattern of or an experience with major depressive disorder, there's clearly something involved. And they do know that you have a bigger risk of developing seasonal affective disorder if you have parents or siblings, first, what they call first degree relatives who have this. But of course, that could be related to if you're all living at a high latitude, someplace with less light. But I think just the really relevant or important thing to know, right, is that if you have a family risk for depression, this is a form of depression. If you have a family risk for bipolar disorder, if you have a family history or family members that have ADHD, right? These are all conditions that have some interrelation here. And so those are things to be aware of.
So, Sarah, does that mean that children and teenagers can experience SAD?
Yes, so I will put the caveat out there that my work and so most of my knowledge of the research is with adults. So I have a little less expertise here, but I have read that there are estimates that between 2 and 6% of children may experience seasonal affective disorder. Um, so pediatric providers have identified certain things that parents can look for. So irritability, crying more often, increase in temper tantrums, problems going to sleep, kids who might complain about headaches and stomach aches. And of course, again, as we just said, that ADHD, you're more likely to have seasonal affective disorder. So that's true for children as well, which means that if your child is having worsening attention deficit issues, there may be some connection to seasonal affective disorder. And for teens, parents might notice that their schoolwork is suffering, that they're having more difficulty than usual getting up in the morning, being late to class, not finishing homework. Grades might be affected. Again, trouble concentrating and remembering details. And similar to adults, teens may lose interest in activities that they previously enjoyed. And with the winter pattern seasonal affective disorder, teens might also find themselves craving carbohydrates, overeating, and potentially gaining weight.
So, Sarah, I do have a question just because we had talked about the Lightbox and some other things like that. And some of the research indicates the cause of SAD can be found in the retina of the eye and not in the brain, as with other mental illnesses like depression or anxiety. So, I'm just curious what your thoughts are about that and how that might affect treatment options for SAD as compared to like major depressive disorder.
It's a great question. This is, I think, some pretty new research. And so I don't know much about this. So we've already talked about how shortened exposure to daylight hours and light intensity during the winter season are risk factors for seasonal affective disorder. And so researchers have observed that retinal photosensitivity, that there's reduced retinal photosensitivity in seasonal affective disorder patients in the winter. So they've started investigating this in mice, and they don't know what is the basis for these underlying seasonal changes in the retinal photosensitivity. They found them. They've observed it in humans. They've found it in mice. So what I'd say is stay tuned. This is clearly an area that they're looking at going forward. It makes logical sense when you think about, again, the risk factor of living somewhere with shorter daylight amounts of time, shorter daylight hours during the winter, and with the Lightbox being an effective treatment. But this is really pretty new science, and so I'm not sure ultimately what will end up meaning for treatment, but it's wonderful that they are looking at this. And I think the more that we understand underlying causes, hopefully the better we'll be able to effectively treat people. And again, thinking about similar to pre-planning, if we understand this and maybe can get ahead of it, maybe it really reduces people's symptoms and suffering over time.
Yeah, I think that this new research is so fascinating.
What do you feel would be the biggest takeaway from someone that's listening and learning about SAD for the first time? What would you feel would be the biggest takeaway you would want them to have?
I think it can be really difficult for people, particularly given that guilt can be a symptom of depression. It can be very difficult for people to feel that their experience is valid and that it's real. And so I hope if you're listening and you have concerns about your mood related to whether it's winter seasonal pattern or summer seasonal pattern, I hope that you're able to let yourself recognize that a lot of times we blame ourselves or think we just have to work harder. And this is maybe a good opportunity to recognize that there's a lot of outside factors that have an influence too, and that there may be some real good help and support out there so that you don't have to go through this experience on your own. And a lot of our listeners are probably part of the Dartmouth Health community and live in New Hampshire or nearby, which means that you have more vulnerability for this. So it's absolutely worth talking to your team and getting some help and support.
Sounds great. I think this has been like a lot of really good information. I know I learned some things as well that I wasn't aware of. Sarah, we appreciate you being here, and hopefully, everyone listening has learned a little something that will help them or maybe someone they care about. And if you haven't already subscribed on your favorite listening platform, please do so. And if you like what you're hearing, please share with a friend or leave us a rating or review. And we would love to hear from you. So please send us any feedback, questions, comments, or if there's something you'd like us to cover at dhbhs.media at hitchcock.org. And thank you for listening.